Paula Cahill. I'm a nurse practitioner and I'm currently the department chair at City College Student Health Services. And then World TB Day, it's the first time that I know of that we've hosted it here, but Dr. Julie Higashi from TB Control, we work very closely with her on students that are infected, and she asked if we would want to host it this year, and so we were honored to have them come do their World TB Day here at City College.
California reports the most tuberculosis in the nation. We have more TB cases than the two next top states, New York and Texas, combined. Every 4 hours in California, we have a new Californian diagnosed with tuberculosis.
My name is Ashley Despain, and what brings me here today to the World TB Conference is I am a survivor of TB. Just a few short weeks ago was my last visit to the TB clinic. My doctor, Dr. Higashi, right here. She's the one who saw my final x-ray and gave me the all clear and said that I was cured and that I could continue on with my life.
In summary, we're at a critical point in San Francisco with tuberculosis control. We will be addressing our funding gap by working more with our community providers and asking them to take a greater role in going and diagnosing and treating TB.
Every day, team members throughout 61 jurisdictions in California go out and find TB suspects and TB persons who have been exposed and make sure that they get on effective treatment, make sure that TB is not spread.
My name is Sunny Clark. I'm Associate Dean for Student Health Services at City College, as well as District Public Health. And I've been at City College for over 25 years. And at City College, one of the requirements is that anyone who works at City College, be it faculty, staff, or students, they are required by law to have TB tests. And many of the students, as you could imagine, are very fearful. They get very anxious, so we really take the time to educate them about what it is and show the small needle that it is and things like that, so that they are much more comfortable. And also, after we screen TB, and if they need chest x-rays and things, we collaborate with other agencies, such as the TB clinic, Department of Public Health TB clinic at this county as well as the other counties. And then we jointly manage the active TB cases. Over the years, the DPH TB personnel and ourselves have actually come to classrooms and did mass screenings when there were active cases. So we have long history of working collaboratively in screening, diagnosing, and managing TB. And those students who have particularly troubling active TB cases, the medications are given out at the health center, so it becomes much more convenient for our students.
San Francisco General has sent their workers over to enroll people in free TB testing, and they're doing some studies also to compare the different ways to screen for TB. There's blood testing now, and there's TB skin tests, so they're kind of doing some studies to compare those.
Breathe California has been around since 1908. We were initially the San Francisco Society for the Study and Prevention of TB. And in that time period, 1 in 7 San Franciscans had TB. Some of the leaders in our city came together to develop the public health infrastructure that we have today to help deal with the epidemic. And the main way, by the 1930s, TB was down 60%. We didn't have antibiotics. We didn't have x-ray machines yet. It was down because people were on the street, knocking on doors, doing public education, getting people into clinics, getting them into open-air schools, open-air hospitals, and getting them separated. That on-the-ground level of intervention is needed with TB. And we're very concerned because as the funding keeps getting cut back further and further, we see our local TB department understaffed. And so I'm here to ask all of you to let your local legislators know that we need to keep funding for TB. Even when the rates go down, it's an infectious airborne disease. It knows no borders, and as we've heard today, it's one of the leading causes of death from infectious disease worldwide.